You know,
Absolutely.
I'm a retired heart surgeon. For about 20 years, I used to open people's chests and do bypass surgery, put valves in them, take the vein out of their leg, and do bypasses on their heart.
Yeah.
And I would do lung surgery too, go in their chest and take out lung tumors. So I'm real familiar with the problems that you have. And I'm also real familiar with all the drugs and pharmaceuticals that doctors use. I used the most high-tech drugs that they had. And you have to use them with caution, and they help a lot of people, no question.
Yeah.
But there's some drugs that don't really help a lot of people. And the drug manufacturers sell these drugs, and they have a lot of complications that cannabis doesn't have. And there's a lot of people don't like cannabis because they don't understand that it could help people. They think it's an evil drug.
Yeah.
We have a video of a patient recently that his grandmother was dying of cancer, and she was dying over a period of about 5 years. And he said that over the last 2 years, his grandmother was bedridden. His grandmother was bedridden, and this is important for you to hear this. His grandmother was bedridden for 2 years and couldn't eat, and basically was taking the medicine with Ensure, and couldn't eat at all, and basically wouldn't even drink Ensure by itself, only drank the Ensure with the pills, okay? And about 2 weeks before she died, the daughter and son talked grandma into smoking a joint of marijuana. And grandma had hated marijuana her entire life and thought it was just like heroin, okay? And so they talked grandma into smoking a couple weeks before she died, and they started smoking this joint, and all of a sudden, all three of them started laughing. And it was the first time grandma had laughed in over 2 years. And as the man told his story, tears started streaming down his eyes. And he said, after about 15 minutes, grandma asked for something to eat. And it was the first time in over 2 years that she had asked for anything to eat. And the man said, with tears in his eyes, he said that grandma had access to a whole pile of pills right next to her. And none of those pills ever made her laugh. And none of those pills ever made her hungry. And for the first time in over 2 years, she was eating and happy. And he said, don't you tell me cannabis is not medicine. Marijuana is good medicine, and it helps people. And it's not heroin. It's not crank. It's not cocaine. It's different. That's why they call it a different name. It's better than aspirin. It's better than Motrin. It's better than Tylenol. It's better than any sleep medicine. It's better than any anti-anxiety medicine. So hopefully we've helped you understand that this man has the right to use this medicine, and hopefully you won't prevent him from doing that. We're begging you, please don't prevent this man from getting the medicine that he needs. If you can show me that this medicine is going to harm him in some way, a legitimate way, then I would concur with you. But unless you can show me in some legitimate way that cannabis is going to hurt him, I would like you to back down and let him use this medicine and watch and see how he responds to it. You might learn something from this experience. People in Kansas need to know that their loved ones could be using this medicine and it would help them better than a lot of the pharmaceuticals that doctors have. In the future, doctors will be required to give cannabis as a medicine because they have to give the safest medication for whatever disease process they're treating. And if cannabis is safer than any other medicine for whatever disease process they're treating, then they'll be forced to use cannabis to help people. And it won't be long, cannabis will be legal throughout the United States, throughout the world. All right, and what's the main reason you used cannabis before when you were using it? For anxiety, sleep?
It calmed me down.
So it helps with anxiety.
But some of it makes me more anxious than the other.
Yeah, some of the cannabis, the sativas, make you more anxious.
Right.
So you probably should avoid the sativas and just use the indicas.
Yeah, see, I don't understand the difference.
Okay, well, we'll go over that.
Okay.
And does cannabis help you eat?
Oh, yeah.
Gives you the munchies and helps you with anxiety. Does it help when you have arthritis troubles, bad back and stuff?
Terrible pain problems.
Okay. And chronic pains, right?
Yes.
And the hip replacements. Does cannabis help you with mood elevation?
Oh, yeah.
And with stress?
Yeah.
Okay. Does it help improve concentration?
Definitely.
Okay. It helps when you're sleeping too, right? Insomnia?
Yeah.
Okay. So you said you used cannabis for maybe 30 years?
It's been a long time. Actually, the first time I smoked I was 7 years old.
Oh my goodness.
I was
So
advised to that.
So let's say definitely over 40 years, okay? How much before when you were smoking, less than a joint a day or more than a joint a day?
I smoked about a joint a day.
One joint
That
a
was
day.
when it was.
And you
From
know about
Mexico.
vaporizing? You know about, I just
I'm
told you about
familiar with
vaporizing.
it, yeah. I had
Okay.
asthma as a kid, so I know
Did
about
cannabis help you
vapor.
with asthma?
I would think so.
Or you
I
don't know?
only had
well,
it recently.
Okay, you haven't had any recent, okay.
No.
And you've never been harmed by cannabis, is that correct?
No.
And does cannabis work better than aspirin, Motrin, Tylenol, Benadryl, all over the counter
I
medicines
would
really?
think so, yeah.
How many pills were you taking a day though, a maximum?
A lot.
Give me a guess.
I was taking pills every 3 to 4 hours. I'd take the pain pills, the Vicodin, the Valium, all that stuff together every 3 or 4 hours.
So just multiple.
And I would keep records
hands full-
on it.
Hands full of pills then, basically.
Yeah.
Okay.
That's what it takes to deal with pain.
Has any physician advised you not to use cannabis?
No.
Any doctor tell you that?
They just disapprove of it, period.
Well, they did tell you can't use it?
No, they didn't.
Okay. All right. And has your mental condition ever worsened
No.
when you use cannabis? Okay. All right, well, here's the exam. You've been using cannabis over 40 years, and you never had a problem with it, right?
Yeah.
So that means this is proven safe medicine in your hands.
Yeah.
Since aspirin kills 1,200 people a year, Tylenol is responsible for more liver transplants than any other medicine, and all the other classes of medicines, the pain pills, the anti-anxiety pills, the sleeping pills, the anti-inflammatory pills, virtually all of them can be replaced using cannabis, and cannabis is safer than any of those. So if I could, as a physician, if I could give you something proven safe and replace something proven dangerous, it would improve the quality of your health care. Is that correct?
Yeah.
That's the exact words that the state medical board wants us to use to identify a cannabis patient. We're improving the quality of your health care by substituting dangerous medicines, and we're replacing it with something safe. Okay?
Yeah.
This is his evaluation to be seen by a doctor for cannabis, and he's going to be able to purchase cannabis with this document. He can basically go to any cannabis store in the state, or have people deliver his medicine to him. Okay. All right. God bless you. I hope maybe we've made an impact on you. Probably not.
I don't think so.
That's too bad. I apologize.
Barge in like that.
Come on, people!